So Emily, I'm going to talk a little bit about having prostate surgery and the implications of that, or things that you might want to consider afterwards.
Yeah, absolutely. So post-prostate surgery, men tend to get several different symptoms. So incontinence, about 66% of men will experience some urinary incontinence after prostate surgery. 77% of men will experience erectile dysfunction. 22% will experience climacturia, which is leaking urine when reaching climax. And 33% of men will experience some kind of orgasm dysfunction. So whether that's pain with orgasm or not being able to reach orgasm. So the statistics are quite high. So it's really, really important to pay attention to the pelvic floor muscles after having surgery, because doing some simple strengthening exercises can really, really help with all of these symptoms. So you should start them as soon as you can. You can do them laying down, you can do them on side lying, you can do them in standing. If you have a little look back at the video on pelvic floor anatomy, so you can have a little review of the pelvic floor muscles, so that you know where they are. And then there's two parts to doing them correctly. So essentially some of the muscles wrap around the back passage area, the anus, and some wrap around the base of the penis. We want to be activating both parts of those muscles. So to do them correctly, you need to imagine that you're stopping yourself from breaking wind, and then imagine kind of nuts to guts. So you're trying to draw your scrotum towards your belly button. You can also imagine that you're stopping your flow of urine, or slowing your flow of urine, and then you can relax and back down to resting. Try and keep your tummy relaxed, so you shouldn't be engaging through your tummy muscles or your bottom cheeks. You'll tend to do this if you're squeezing your glutes. And you can test them by trying to just stop or slow your flow of urine when you're on the loo. Don't make a habit out of it. Just test them out to see if you're squeezing the right things. Try and get into a routine of doing these, so 2 to 3 times a day ideally. Trying to do a mixture of some shorter ones and some longer holds. So shorter you can squeeze and release and squeeze and release. Do until you get a bit tired. So you might be able to do 4 or 5, you might be able to do 12. You just need to work until you feel a bit tired, have a short break. And then you can try and do some longer holds. So you can start by trying to hold for maybe 3 or 4 seconds, then release down for 3 to 4 seconds. See how many of those you can do. Build the repetitions up, and then try to increase the time that you're holding for. Don't be tempted to progress too soon with the exercises. Just work till you start to feel a bit tired. And just 2 to 3 times a day is absolutely fine. You don't need to do them any more than that. And you should start to notice over sort of 6 to 12 weeks, those muscles start to get a little bit stronger, and those pelvic floor symptoms will then improve.